Dr. Edward Mills is the founder of the Atlanta Center for Restorative Dentistry. A graduate of Emory University in 1980, he has lectured extensively throughout the world on state-of-the-art restorative techniques. Dr. Mills is a fellow, as well as the 2003 president of the American Academy of Implant Dentistry, and a diplomat at the Board of Oral Implantology. Dr. Mills is the founder and current director of the Atlantic Institute for Advanced Education, a state-of-the-art educational facility utilized to train professional adults through lectures, live demonstrations, and internet educational format. Additionally, he is the current co-director of the Medical College of Georgia's 390-hour comprehensive dental implant training program, considered to be among the top continuing educational programs in dentistry, and he is the director of a 3-year hospital-based dental implant residency program at Emory Adventist Hospital. Dr. Mills has lectured extensively throughout the United States and abroad on both the surgical and the prosthetic aspects of dental implantology.
How long have you been in aesthetic dentistry, specifically whitening teeth?
I guess I've been involved in whitening teeth on a fairly active level for over 28 years.
Why did you decide to put our teeth whitening process in your practice?
As I started investigating, what the process was, what you find is they've got a very nice mouthpiece that's got a sponge built in it, that the sponge holds carbamide peroxide in it. A pretty high percentage, 44%. And it's a fairly strong concentration of carbamide peroxide. But the mouthpiece and the sponge is designed so well that it localizes the carbamide peroxide pretty exactly on the teeth, and it's translucent enough that if you put a light on it and warm the carbamide peroxide, it increases the efficacy. The advantage of this over most of the traditional techniques that are being used in dental offices is primarily in the preparation time, where Zoom and some of the other techniques, the isolation, the patient's mouth might take almost an hour, even with good technicians. This is something that can be done fairly safely and relatively quickly, and you get pretty nice results.
How do you compare this process to a Zoom process in your office?
I might compare that to a facelift in plastic surgery, and this product is more like maybe Botox injections or something. It's really a whitening enhancement, and I mean, to my surprise, you wouldn't believe how many patients right after cleaning appointments are saying, look, I'll stay an extra 30 minutes if you can enhance my smile.
So how many of those patients would you say over the last month, percentage-wise, it said, hey, this is economical, I'll stay around? What would you say that the figure is right now?
I'd say at the very beginning, we were probably doing, I think we did 20, 30 the first week. And then the patients that started coming back in, for that, we told them about the fee of it, and they were really intrigued with it. And so what we started doing is on their second cleaning appointment, we started scheduling an extra 30 minutes beyond their cleaning appointment, and there I'm going to have an assistant do the whitening procedure on them. So I would say a fairly high percentage, maybe of the people that we talk to them about it, which not everybody's a candidate, but of the people that we talk to them, I'd say maybe 40%, 50% of everybody that we talk to, has said, look, put me down for an extra 30 minutes, and, we're giving a great deal financially. So,
what is your patient satisfaction?
As far as patient satisfaction, at least right now, virtually everybody that we've done have felt that they've got more than their money's worth, and they feel really good about what we've done, with this procedure. And, having patients happy and fulfilling their expectations is really what I'm about.
We know the number one concern of patients is sensitivity. What has been your patient's experience?
In our practice, we do everything to minimize sensitivity. We've virtually found really no dental sensitivity. There is some blanching, of the soft tissue, which basically it's a little bit of white discoloration at the border, and we make the patients aware of this up front, and it lasts 15 to 30 minutes. So we tell the patients, you're going to get a little whitish discoloration in your gums. It's not going to create any issues, and it'll go away within 30 minutes.
Dr. Mills, now that you've had the IMDS Artis process in your practice for 60 days, do you have any reservations?
I had some reservations. Having said that, once I've got it in, I've been really amazed of how well accepted it's been by not only our patients but our staff. They like it. Everybody likes it. I'd say almost every one of our staff people, have wanted to end up doing it themselves. And once they get their teeth whitened and they like it, and they feel that they fulfill their expectations, it's really easy for them to talk to patients about it.